Hi again, everyone. It's Ryan from Walking Mobility Clinic in Barrie and Aurelia, welcoming you to another episode of our How to Fix Your Feet at Home series. In this particular episode, we're going to be talking about medial arch and medial ankle pain, which is pretty common. There are, of course, lots of different reasons for that pain, but probably one of the most common ones relates to a specific tendon that's very important to the feet when we're walking, when we're running, when we're really doing anything on our feet. And that particular tendon is the one that's called the tibialis posterior tendon. It runs deep to the calf muscle. So your calf muscles are made up of two major muscle groups called the gastrocnemius and the soleus. Deep to that, on the inside here, is this tibialis posterior tendon. And the tibialis posterior runs from the inside of that leg deep to those muscles, comes around the inside of your ankle, your medial ankle, your inside ankle, and attaches in the arch. Now, its job primarily is to slow your foot down from what we call excessively pronated. So it's the main decelerator of pronation. So what that means is that when your ankle and arch want to roll down a little bit, which is good, it's the ability of your foot to adapt to the terrain you're walking on. It's the ability to give yourself some shock absorbency within the anatomy of your body. So pronation is good, but it's supposed to slow that down to allow the normal amount of pronation, but disallow that excessive amount. So when we have feet where our feet are rolling in too much, some people might think of it as having a flat foot. Runners out there may have heard of pronation before, and particularly excessive pronation. So that particular tendon can be under load a lot. There are various symptoms that you'll experience with this. It could be pain in the arch, right in where it attaches into on those bones in the middle part of your foot. It could also be medial ankle pain, right around that, as that tendon runs along just below your ankle bone. It can also get a little higher up into the leg, and you might think of that if you've heard of shin splints before. Well, the tibialis posterior is the main form of shin splints. There is another form with its sister called the tibialis anterior, but more common is the tibialis posterior. So what we're going to talk about today is some stretches, some exercises, some ways to strengthen that particular tendon to help with this particular problem. And then maybe in another video, I'm going to show you some of my thoughts about things that you might find off the shelf, and maybe even some things that you can make at home that might give you a little bit of relief until again, you can get in to see somebody for a professional opinion. All right, we'll talk to you soon.